Hello, I'm Dr. Christina Parker at Masonville Animal Hospital.
And I'm Krissy, one of the technicians at Masonville Animal Hospital.
And this is one of our technicians, kitty's Marty, and he is here for his physical exam today. So we'll kind of walk you through what we do with a typical physical exam and a few things that we really focus on with our senior kitties, as Marty here is 10 years old at this point. So we kind of do a physical exam from kind of the tip of the nose, the tip of the tail to make sure everything is working well. So I'll kind of walk you through what I do to start. So usually to kind of not get in their face too much, I kind of look at their ears first to make sure that there's no discharge in there, no kind of funny smells or any lumps or anything like that. So that's looking good. And I'll kind of work my way down to take a look at both of those eyes to make sure that I'm not seeing any redness, no squinting, and no lumps kind of along the eyelids as well. And we'll take a further look with a scope into the eyes in a few minutes. Kind of look at the nose and at the rest of the face to make sure it's nice and symmetrical and no issues in there. And then we'll kind of focus on looking at those teeth, especially with our senior kitties. We want to make sure that we don't have any dental problems starting up. So we kind of look along the gum line on both sides to see if there's any tartar buildup, any missing teeth, any kind of teeth that are causing pain. So I kind of look on both sides there to see how they're looking. And then if they'll let us, just kind of opening and looking inside as well. And usually you only have a quick glance in there as well, kind of when they have their mouth fully open. And as I'm kind of here, I'm feeling his lymph nodes in here. There's a few lymph nodes at different parts in the body. And if those are bigger, it can mean that there can be infection or inflammation going on. So just making sure there's no concern there. As I move down to kind of the forearms, just kind of working to make sure that there's no mobility issues and no lumps or bumps kind of on either of those forearms there. And kind of looking at the toes and the nails to make sure that there's no issues there as well. Marty doesn't like his feet being touched too much, but that's okay. And as I kind of work my way down to the chest, I'm going to take my stethoscope here and really listen to the heart. So I'm listening for any murmurs or extra sounds in the heart. I'm listening to the lungs to make sure that they're sounding nice and clear and there's no wheezes or any extra lung sounds in there. So we'll take a quick listen here and make sure we're sounding good. Good. Those are good, buddy. We're moving our way back. That's okay, buddy. So then as I'm kind of working my way down to the belly area, I'm kind of feeling along the top and the bottom to make sure that there's no lumps or bumps that we're feeling in there. As well, kind of looking at this coat condition here, especially kind of in our senior kitties. An area to watch for is at the very back at the base of the tail. If that area is getting kind of dandruff or more greasy looking, it could be evidence of a few diseases starting up. So a good area to kind of look for here as well as at home. And then kind of with their belly, I kind of start at the top, kind of feeling where their kidneys are, and then kind of underneath feeling at the rest of the organs to see if they are a normal shape, if there's any pain, any fluid or discomfort in there as well. And then we'll just kind of take a feel of the back legs as well. I know, Marty, you're being very patient with us here. So with the back legs, we're kind of, pressing down to see if there's any pain in those hips, any arthritis starting up, and then gently just kind of feeling if there's any.
Goofy.
It's okay,
It's okay, buddy.
You're all right. Gently just feeling if there's any kind of pain as we're kind of moving his back legs around as well. And then we kind of look at the base of the tail and see if there's any discoloration or any kind of worms or anything like that there. And then there's some lymph nodes at the back as well. And then just running along to the base of the tail to make sure that, that there's no kind of breaks in the tail or any discomfort there as well. And then kind of another thing that I go towards with our senior kitties is making sure their eyes are looking okay. So we take a look with the light in there and just make sure that there's normal eye changes happening, there's no cataracts or anything unusual in there. So we'll take a quick peek in here as well. And those are looking great. So that is our physical exam on Marty.